Hi, good morning, everybody. I'm just going to get my screen situated so that I can navigate everything. So, good morning, everybody. We will be going over the information and resources that you need to help better support you in the in-home care workforce. So, go to the next slide. So, what we will be going over today is where to find the information and the resources um, at the OHCC website. So we'll be going over training required and voluntary, how to earn certifications for higher wages, health and safety reports and how to make one. This includes workers' compensation, PPE, reporting health and safety issues. We will touch quickly on how to report a late or partial payment issue. We will go over briefly the payment systems for all provider types today, which is PTC, provider time capture, as well as Express. We will touch quickly on the payroll calendars as well. We will actually show you where to find the frequently asked questions and information on background checks, how to file parking reimbursement requests and where to find that information. We will also be going over the payment systems again, PTC and Express. We will also go over where to find the collective bargaining agreement, Oregon Saves Retirement, and then we will actually be going over the Provider Navigator Assistance Program as well at the end. So to begin, the website is actually located on this PowerPoint right here. Let me go over there. This is the actual website.
JJ, this is Jenny. I just want to
Go ahead.
chime in. Hi, everybody. Thank you so much for being here. So, the PowerPoint is intended to be a resource for you to refer back to later. So, it has all the slides, all the pages that JJ will be showing you, their screenshots and information about how to view things in different languages. So, that's why you're not seeing the PowerPoint right now, but it will be a resource for you.
Correct. Jenny, are you able to put the link in the chat? I thought I was going to be able to do that, but I'm not
Yeah,
able to
sure.
pull the chat up. So this is the main page of the Oregon Home Care Commission. You can find the contact information all through here. If you scroll to keep scrolling down. Oh, nope, we're going to scroll up. If you need to change the language from English, it's to the right corner up here where it says languages, and there is 10 other languages. That's not including English. That will change the whole page. So just for an example, this is Arabic. We'll change it to Spanish. It changes the whole page. We'll go back to English. All right. So where we are going to start, so I did show the different languages that we do provide in the website. We will be starting off by going to the home care workforce for resources, which is located right here in the purple button.
JJ, I was just going to add, you may want to bookmark this page on your computer because you may need to go to it frequently or just know where to find resources, and it would be easy for you to just use the bookmarked website.
There we go. I'm going to try and put that in the chat. Okay, so go back to my PowerPoint. and then see where I'm at. Okay, so in here we have a bunch of different resources. We have the general customer relations support. And if you have ever used this green button, you will normally see me replying to it with more information. So what we do in that button is we offer parking reimbursements. We offer ADA accommodations, complaints, training, and certifications regarding local offices, um, Karina support, mostly information that can be just be sent to you for you to be able to contact. So if you don't have the contact information, we will be able to provide that. For copies of pay stubs, W-2s, employment income verification, when we get those requests, we send them off to the department in which you are working for. So for home care workers, we send it to the ABD. For PCAs, we send it to the OHA, Oregon Health Authority. PSWs, we do ODDS as well. Because we don't personally process those. So I need to go back to my slide, get out from underneath everything. Did I go too fast? Okay. So yes, I did. I went past a screen. Nope, I didn't. Sorry. So on the website, I want to touch bases with on to the right here. There's resources for the home care workforce, which is what we are on. There's also the training and education button. By clicking that, it will take you to a lot of information that OHCC provides as far as voluntary classes to increase your wages. For these power hour meetings, the button is right at the top. You are able to view multiple power hours that we have actually already completed, and it is recorded. Let me go back. Again, sorry, I am going a little fast. You can change every website to a different language if needed. Okay. In here, we also have the Elevate newsletter that comes out on a quarterly basis. The history of them is also in here as well. If you're needing the CareWell training information, the button is actually right here, and it will take you directly to CareWell.
JJ, oh,
Okay.
sorry. Will you
Yes.
go back? And I just want to
Yep.
point out that there is a way to access PACE and how to create an
Oh,
account on
I
this
skipped right over
page,
that. Uh-huh.
and then some information, the step-by-step instructions on how to do that. So will you click on English for a second so people can see that?
Uh, uh, yep. It's coming up, I think.
Okay, if it isn't, that's okay. We'll just keep moving on.
It's a Word doc. It's coming up really slowly. It's right here. So registering for the PACE learning site, website is step by step is going to the link that is included into the instructions. And it tells you which, um, basically
So
which,
so you can find that
I mean,
information on our website.
yes, you can find it on the website. Okay. And if you ever lose sight of the PACE website, you can always use this button to sign in. Okay, let's go back to the PowerPoint. So voluntary classes with OHCC, register through PACE. These include CPR first aid, the PDC, which is professional development certification, the enhanced certification, the exceptional certification, BDQ, which is ventilator dependent quadriplegia, community health worker, which is no differential, and stipends paid by OHCC for their trainings. So just so I'm going to put it out there, there is no stipends for this learning session as this is completely voluntary. For Carewell SEIU 503, the link is on the PowerPoint right here, but you can also find the information for the required trainings to continue your credentials and continuing education. You're able to register through their training management system, as well as the stipends are paid by Carewell for their training specifically. And a very cool resource is being able to qualify for Carewell Kicks, which is shoes. So
JJ, I'm just going to jump
go
in
ahead.
too.
Yeah,
So we wanted to go over this slide because I think there's a lot of confusion as to what training the commission does, what training Carewell does, where to go for what. So we wanted to make sure that it was more informative about why you would go to Carewell and what you would go to the OHCC trainings for. So if something is required, like orientation, core training, or continuing education, you would go to Carewell for that. If it's something voluntary and you want to earn a certification that leads to higher wages, that's where you go to the commission. Carewell and the commission have different learning management systems. So that means for commission trainings, you would use PACE to go to our trainings, whereas Carewell, you would go through the Carewell website and use their learning management system. If you take a class through Carewell, they will pay your stipend. So that comes from Carewell. So if you're wondering where your stipend is and you're reaching out to us, but it was a Carewell training, we're going to direct you to Carewell. If it's a commission training, then we pay the stipend for that. And then on that left navigation that JJ showed you, there is a button for certification that tells you all about the different certifications we offer. So if you need more information about that.
correct. Yes, and that's on the right-hand side, certifications, and all the information is in here. You're also able to change the languages as well. And then just clicking on one, it will give you a drop down with more information. Again, the PACE website, how to upload information to PACE is all in different languages as well. So yeah, anything further?
Nope, just keep going down the left side.
Okay. Oh, okay. So after that, going down the left side, hold on, I want to keep up with this. We did go over this, the health and safety page. I'm going to copy and paste this into the chat, maybe. Okay. So the most important information about this page is when you are currently on the job and you're at a consumer's house and you're experiencing some kind of either hazard or a health issue or a safety issue. Of course, always if it's an emergency, report to the proper authorities, but also by reporting it to us to report a health and safety issue, we're able to actually work with you as well as the case manager entity in trying to find a way that you're not experiencing that moving forward and other providers aren't walking into that same issue. So there is a care provider safety manual here that is offered in all different languages. Scrolling down, we have general resources that is geared for health and safety, including the PPE requests. You'll be able to access the PPE requests from the main workforce page as well. There is health and safety training in here, other resources such as this flu prevention resources. There is resources as far as uh, flyers and instructions of how to remove proper PPE, a lot of information that you're able to just go in and review.
JJ, will
Okay.
you scroll up? I
Yep,
want to make sure that people know where information about filing a workers' compensation claim is. So if you're injured on the job while working for an individual, we want you to reach out to our workers' compensation coordinator to let that person know what's happening and they can help you file a claim through SAFE. Of course, we always want you to go seek medical treatment right away if you are injured and you need medical attention. And when you go to the doctor's office or hospital, they'll have you fill out a special form if it's a workers' compensation issue. And then the commission and our workers' compensation team will help you through that process. Whether you are approved or denied for that claim, that's determined by SAFE, but we're here to help you through that process.
correct. All right, moving along. We went through the health and safety. So to get the latest news and updates with OHCC, all the information is located here and it's offered in different languages as well. And the current what we have right now is the rate and wage study findings and recommendations as well. So, and then last but not least on this side, we have the Oregon Saves Retirement Plan. Um, really, that's offered through it's the employment department, I believe. No, it's Oregon Saves Department, but we don't have access to the Oregon Saves, but we can provide you with the resources needed to be able to get that information as well. All right, so we will be going over the resources into further detail, such as the customer relations support. I did go over this top part. The purple button, this is a big button, very important. If you are thinking that you are at any time possibly going to be paid late, be paid partially late, and it's not your fault, we request that you complete the later partial request form immediately as soon as you do know. And going into that, it really is just a quick form. You're going to complete it, 2 pages worth. It does have a little bit of information of if you need assistance by completing this form, you would contact OHCC or the SEIU Member Assistance Center, and that contact information is located on the main page.
JJ, will you show them also how it's available in multiple
Oh,
languages?
of course. Sorry. Thank you.
So if you fill this out in another language, we will get the information and have it translated, and we'll be able to understand what you're asking us and what the issue is, and we'll reach out to you in your preferred language, usually with an interpreter.
Correct.
And then one other thing I wanted to say about this, a helpful tip, if at any reason you are not getting paid, so there's not service authorization
Yep.
in place, or you haven't received anything in writing authorizing you to work, we want you to contact the local office that you're working with. We don't want there to be any delay in you getting help. So report it to us, but also contact the local office. And if the case manager or home care worker coordinator or services coordinator, personal agent is not available, we want you to ask for either the worker of the day or a supervisor. So we want you to know that
So
there are
Rama
other
is
options for you,
asking,
other people to talk to other than the
she has
case
a
manager.
question, Rama, where I can find the courses that I have to do it.
I think we just had a question for courses.
Yes.
Okay.
Rama is asking where I can find the courses I have to take or apply for.
So as a new provider or renewal? Because that's what we were going over earlier as far as if it's a new training.
JJ, what
Uh-huh.
was the
Well,
question?
in general.
Oh, was there a
Yeah,
question or you're just going through the? slide? Sorry.
There was a question, yes.
Okay, so if there's a question, just read it out loud so we know what you're answering.
So they were asking if where to find the links for the needed training. And it wasn't specified whether it was new or if it is for
No, she didn't specify anything.
okay.
She just wrote it in the
So
chat that
anything
where I
that's
can find the
required
courses.
for, and it's not a certification, any required training would go through Carewell.
Correct. Any required training would go through Carewell. It is right here. And if it's to increase their pay rate, then it would be through the PACE account, which is assessing training through PACE. Okay. Sorry about that.
So we can go back and answer questions after JJ goes through the website.
Please, yes, that would be extremely helpful. So going back to the later partial payment request form, if you immediately, once you notice that you're no longer, you're being paid late or partial, please complete the purple button. If you, as we noticed in the health and safety area, we did have the PPE request form in that area. Here, you can also request for it by clicking on the blue button, is ordering PPE, personal protective equipment, for gloves and masks.
I also want to mention, sorry, JJ,
No, it's fine.
I'm JJ's sidekick today.
It's beautiful.
If you need gloves and masks and you can't wait for us to send them to you, you can also go to the local office and request a 30-day supply of that personal protective equipment. But if you have the opportunity to wait for us to mail them to you, you can click that blue button and we'll help you with that.
Correct. And those get sent out on a weekly basis. We went over this. We just went over that. So yes, step one, contacting the local office, complete the partial, and then step two is completing the late partial payment request. Helpful tip, if you can't reach the case manager, ask the worker today or supervisor. Yes, I just repeated that. And we went over
You do the
this.
slides and I'll do the talking points.
Okay.
You do the website, and I'll do the talking points.
Okay, so going over the health and safety issue, the big issue that or big important information that I would suggest is saving the safe phone number for mandatory reporting into your personal phone so that you have it on hand at all times, and you're not having to call people to get the phone number. So it's anytime that you want to report abuse or suspected abuse of an individual who you are supporting. Okay, and that health and safety report is this big button right here. I want to call it what, fuchsia, red. Okay.
And again, we want to make sure you know that you can see this information and submit this information in different languages.
Correct. Again, that button is still at the top here. All right. I believe we're going over the frequently asked questions and still need help contacting us is down towards. So the frequently asked questions is right underneath the reporting health and safety issues right here. By clicking this link, it does bring down a drop down. At that time, what you will be able to see is how to access the current 25-27 collective bargaining agreement that is in different languages as well.
So JJ,
Uh-huh.
I'm going to just mention, if you haven't seen this 2025-2027 collective bargaining agreement, it's actually a summary of all the different changes during collective bargaining and all the different changes to, training or anything like that, the rate increases, information about the step increases. So we would encourage you to check that out. And then it also has the new payment rates attached to the steps. And if you need more information about step wage increases, we would encourage you to go further down on the page there and click that information about wage increases. To see the current rate attached to each step, you will need to go back to that information about the collective bargaining changes.
Yeah, so I did click on the link. It did take us there. This is the first FAQ for the step increases. There is actually two editions for that. So part one and part two are both here and offered in different languages. A big one also to keep in mind is how to complete background check. If you have any questions while you're completing the application for, your credentials. Okay. So scrolling down, having important links for you to save as well. Knowing what provider type you are is very important so that you're going to the right areas and locations and contacts. So for PSWs, a lot of the information is going to be through Better Online Web Portal, and that is actually linked here. Timekeeping is Express. Training and education is also here, and PSW contacts. So very helpful information. I'm going to click on the training and education for PSWs. It does take you to the OHCC training and education link as well. There is PSW resource page. This has been very helpful for me when I'm answering questions. I'm going to put that in the chat for just PSWs. PSW only.
JJ, do you want to go back
Mhm.
real fast and
Sure.
show everybody where they can find the payroll calendars?
Payroll calendars are right here, just below all the types. So knowing exactly what provider type you are as well will provide you what payroll list that you do require. So for home care workers and PCAs, personal care attendants, the pay periods are listed to the left of the page. The deadline to submit time entries correctly is the most important column here because you want to make sure in order to get paid timely that the time has to be entered timely. The payroll processing date is the date that the actual checks or direct deposits are released to you. And another column is the state federal holidays that impact timelines and pay dates that you might run into. Let's go back. That's for PCAs and home care workers. For PSWs, they are here as well. Well, maybe not. 26. Okay. So pay period, start end dates, time sheet deadline to have them all the information added into Express, and is all right here. This is the big column that you want to be important to because any timesheets that are received after this deadline will be processed late as well. Okay.
This is Jenny. I just want to point out if you're a home care worker and a personal support worker, just to remember that you follow different payroll calendars.
Correct. Okay, and scrolling down on the OHCC resources for home care workforce, we are Carina. If you're looking for more consumers, you're able to go into the Carina app and do the matching. Carina matches people seeking in-home services and qualified home care workers, personal support workers, and personal care attendants. If you need any help with this form, you can contact Carina, and the phone number is also right here. So guidance and tools, scrolling down. So background checks, by clicking on this, how to complete a background check, frequently asked questions. The process, please note that the background check process can take up to 70 days. So before you submit for all provider types, you would have to start the process 70 days prior to your credentials ending to guarantee that there's not going to be any break in credentials. If you are in the greater Portland area, you may have to be parking in on public parking downtown. I know that Salem does charge for parking at times too, but we would require a receipt, the date and time of the parking occurred, and we will provide resources or reimbursement for those parking expenses. More information of how to do, like looking for where you're at by city, is also is in here as well. Let's see, down further, we also have the benefits collective bargaining agreement and retirement contacts information. By clicking a lot of these links, it does a drop down window. The forms and guides, I did just skip over that, but we have the provider application forms, how to do direct deposit for both all provider types, care provider guide for home care worker, PSW, and PCAs. It is offered in different languages as well. I'm just gonna keep moving. We do have the history of the contracts here. Again, another link. Was that?
All right, so just if you go under the collective bargaining agreement section, you can see the most current collective bargaining agreement at the top. And if you haven't taken a look at that, you may want to do that because that lets you know all the different benefits and um, training opportunities
You're breaking
that
that.
were collectively bargained for you. So I would definitely check out the
Yeah.
collective bargaining
So
agreement. I would check out that link for sure. If you haven't seen your most recent collective bargaining agreement, please take a look at it.
And keep scrolling down. The next link is again for training and education. Yes, you are able to get to these links from multiple different areas. We have it to the right. We now have it in the drop down window here. And it's a lot of good information. Again, the health and safety reports are also here. Multiple areas of where you can click to report this information.
JJ, will you take people to, if you're a personal support worker, to the PSW resource page so that we can let them know what resources are available for Express?
Yeah. So the resources for personal support workers is all right here. Enrollment and renewal links. Express enrollment and user helper guides are right here. Oh, and this page again is offered in different languages as well. A lot of the information, EDD resources, guides, and video tutorials. I think let me catch up on my speaking. Okay, so Express resources. We do offer those in different languages as well. And all the information is translated into the languages as well. So general resources is at the bottom. We have weekly limits and overtime information, training and resources.
JJ, do you mind going back to your PowerPoint and going to slide 23?
Okay. Right here.
Yeah, so we wanted to just point out that on this page for personal support workers, there are video tutorials that you can watch, and it's available in multiple languages. It's not available in all, but this will take you to YouTube, and you can watch a video about how to use Express. So we are always, if you're a personal support worker, we encourage you to also bookmark this page, the resource page for personal support workers. So you can go to these videos or look at those written documents for help.
Yeah, and Again, knowing what provider type you are, it is very helpful. So I did just put this link in the chat for PSW resources. Okay. And we're going to go back to helpful resources. I believe that this is, yes, for home care workers and PCAs, the time entry system that you'll be using is the provider time capture. In here, we do have the pro tips. By clicking this link, it will take you to, oh, this is a good page. It does have a lot of helpful links in it as well, but where I was going,
Go up one.
resources and tips.
No, time. Sorry. Go. Yeah, do the web portal there. Oh, sorry, not that one.
I
Go
know.
back up. I put the link in the chat. No,
Oh,
I
did you?
didn't.
No, you
No.
didn't.
Yes, I did. Sorry, everybody.
I want to say, yeah, because I can't find this page.
Okay. Let me put it
Other
in the
page.
chat. I think I did put it in the chat, but hold on just one sec. Oh, there. Yeah, but you probably can't click there, can you?
It's
Okay,
on
JJ, it's in
the,
the chat.
all right. So this is the provider time capture. It's any resources or announcements that you will need, like any changes that are happening. We do have effective in April 14th of 2026. There will be a two-step verification coming. So any information that you're looking for, you would want to come to this website as a home care worker or a personal care attendant. The ORPTC which is the Organ Provider Time Capture website, it does have the information as far as getting started, what option is best for you, if you have an Apple phone or if you have an Android, and how also your consumer is actually requesting to enter their time as well. So if they only have a landline, you'll be doing it for a landline, and the quick reference guides links are located in here. If they have a fob, to request for a fob, you would have to talk to the case manager. You would have to download the timesheets and
JJ, will you please go back up? We want to show them where their learning resources are.
the learning materials.
Yeah, click on that.
Okay.
So there, if you go to how-to videos,
These take you
you
to YouTube as well.
yeah, so there's various video tutorials you can go to. Again, also we have information available in multiple languages if you click the provider learning material catalog. So if you click there, that's available in multiple languages. And so if you click English, JJ, that will take you to the learning materials catalog, and they have a lot of different resources in there on how to do certain things, and they're also available in multiple languages.
Mm-hmm.
So I know that there are a lot of questions with using provider time capture for home care workers and personal support workers, and we want you to know that there are learning tools available for you, and I just put that in the chat where you can find those materials.
Okay. Um,
So only thing left is about just to show where there's a information about the provider guide. If you go to your slides, JJ.
uh-huh.
Okay, the care provider guide needs to be updated, but it does have good information in there about health and safety, how to file a request for a accommodation for something that you might need while working. And then the last link on the last slide, JJ,
This one?
slide number 29. There are a lot of helpful links for you to find additional information. And these slides will be coming to you, and you'll have all this information after this session. And that is all the website information and where you can find it. And now we want to turn it over to Provider Navigator, and then we can take questions. Crystal, I'm just going to have you wait for just a second so that we have enough time to go through Provider Navigator.
All right. Well, thank you so much, JJ and Jenny, for taking us on a tour on our website, the Oregon Home Care Commission website. Provider Navigator program. This program, if you have not heard about it, it's one of our newest program. It's a program that aims to help enroll providers and new applicants to successfully join and remain in the workforce by providing individual assistance. And so I'm gonna just put in the chat the link to the program, and there is a really cool video for you to watch that on your free time. It kind of gives you an idea of what the program is and what we do as in the Oregon Home Care Commission for this program. So the goals for this program is to really successfully assist you all through the provider enrollment process. And so all of the steps, the enrollment steps are you're supported throughout the process. You have person who is supporting you on one-on-one throughout all of the steps. Also, the program supports individuals. Every provider has 20 hours within this program for that personalized help. And the whole process starts with either you personally putting in a referral for yourself, or anyone that you get to be interacted with, either at the office or the local office, or somebody that is working with you can put in a referral for you to get started and get engaged with us. And so you can see here, there's that referral form is in green button. If you can go to the next slide, JJ. One thing to also mention here that this program is limited duration. It functions across the state for all different provider types, home care worker, personal support worker, and personal care attendants. And it helps in a variety of ways. It helps get you started. As I shared earlier, it helps you to work and streamline the process, with the local office. It helps also managing, work with helps with, timekeeping, using a payment system, keeping track of your tasks or service agreement, managing your time and making sure your paperwork is all up to date. It also supports with skills and training. So, if there is a need, for to work with somebody on a communication message that you want to put on Karina, that's something you can work on with the provider navigator. If there's any kind of other technology skills that you want to be working on to make sure that you are able to clock in and clock out or do historical time entry, or access all of your trainings through either Carewell or Oregon Home Care Commission, that provider navigator is going to be able to help you access all of these different um, systems and set you up for success. Another thing is supporting with finding jobs. We don't find jobs for you, but we support you and give you the tools and walk you through how to utilize the tools that are out there for you to get to find jobs on Karina, website, making resumes, getting ready for interviews and things like that. Staying connected, making sure that we're sharing resources with you of what's out there, and how to navigate like our different systems. And the other thing, the last thing I'm going to share here in terms of how this program can help you is we support with tracking your credentials and seeing where you are at, how to make sure that your certifications are up to date, and how to make sure that your provider number does not expire. And so support with any background check, follow up, and things like that. This is our email. So if you are having trouble, for example, to submit a referral for yourself, feel free to email us. We'll submit a referral for you. We'll contact you and do that with you. Next slide. The services for the Provider Navigator program are available across the state for all different provider types. Again, and I said earlier that this is a limited duration program because it's a limited funding program. So right now you can see there are 4 organizations that are working across the state to provide the provider navigation services. And the Creating Opportunities area, we have Benton, Lincoln, Lynn, Marion, Polk, Tillamook, and Yamhill. Right now, they're mainly providing services for personal care attendants, but they will be able to provide more services in the next couple of months for the other provider types. Lane County Council of Government, they provide services in Lane County for home care workers. We have RISE Partnership, who we have here, and they're going to present kind of a process for us of what happens when a referral gets in first. They provide services in all of these counties here for all different provider types, including in Lane County for personal support workers and personal care attendants. And last but not least is the other organization that works across the state is ARC in these counties, Crook, Deschutes, Jackson, Jefferson, and Klamath for all these different provider types. This information is on our website and the link that I just shared with you. You are able to contact these organizations directly and they will put in a referral for you and start working with you and get you through the process and support you. Just in respect of time, I'm going to hand it to Jolene to give us a little bit of a walkthrough of what happens when a referral gets in and throughout the process.
All right. Thank you, Ms. Sarah. Hello, everyone. Again, my name is Jolene, and I am a lead provider navigator with Carewell Training and RISE Partnerships. I'm just going to give a real quick kind of basic overview of what you can expect after you put in a referral. So after you put in that referral, you can expect to hear from us within 5 business days. That does not include weekends or holidays. And most of the time we can get to referrals much quicker than that, but we do reserve that 5 business day window. Um, if you're filling out the referral form yourself, it's very helpful if you provide us with 2 forms of contact information, a phone number and an email. This just allows us 2 ways to get a hold of you to make sure that we are addressing your concerns. What we'll typically do is give a call. If we don't connect with you, we leave a voicemail, and then we'll immediately send an email. Both of those outreaches will have our contact information. If we don't hear back from you in about a day or two, we'll try again another round of a call and an email. If you are like me and you're bombarded by a million emails and calls from numbers you don't know, it can be really easy to miss outreaches. So if you miss an outreach and you find our email 2 weeks later, please feel free to reach out. There is no time limit on that. So all of our contact information will be on our outreaches. After we do connect with you, we will be able to address whatever concerns you might have or what brought you to the Provider Navigator program. We can give tools and resources. Again, an email is often very helpful because a lot of times there's links and things like that we would like to share with you. So we can send all those and just make sure you have what you need, not only for where you're at right now, but going forward, making sure you have visuals of the processes of becoming a care provider, and links and tools and things for you to support you throughout the whole process. As Masara mentioned, we help with a wide variety of things, everything from the process of becoming a care provider, like the application process, background check and fingerprints, your required training through Carewell. And then we also help with things beyond after you've gotten that provider number, trying to create a Carina account, finding the links and how to create a PACE account for the OHCC trainings. We have tips and tricks to kind of help you with setting up an account in Carina. So that kind of just helps you set up your profile that services you the best. There are some limitations to things that we can help with. They're outside of our scope, unfortunately. Some of those things we just wanted to mention are things like tax information. That's a big one right now. We won't have any information on your taxes. Things also like benefits or PTO are best left to our Carewell Benefits team. So we will direct you to our Member Assistance Center for things with that, and also including things like union concerns or questions about your union dues. We would direct you to the Member Assistance Center, and I believe we can put that number in the chat if someone wouldn't mind. Other things that are a little outside of our scope are medical advice or referrals. We definitely don't do that. Helping a consumer apply for services is another one we get sometimes. We would love to be able to help with absolutely everything, but definitely there's some things that are best left for others. We work with the care provider side of things, and so we are helping the consumer get set up for services or where to go, things like that are just outside of our scope, unfortunately. Our program, I just want to mention too, that if you say put in a referral for the application process and we help you through that part, and then, a couple months later you are needing help with PTC DCI, you can absolutely reach out to the navigator that helped you the first time. We're more wraparound. We want to help you through all of your concerns throughout the process of being a care provider. I believe we can put the link to the PMP referral form in the chat. So if you would like to put in a referral, please do so. Again, very helpful for us if you give us 2 forms of contact information. And also, when you're filling out the referral form, there is a part that says, please describe the help needed. And it's a very thin little box. And so it makes you think that you can't really put too much in there, but you can. There's no character limit on there. So please tell us everything in detail of what's going on. That will help us prepare and have hopefully answers ready to go for you when we contact you. And that's just a quick overview. All right. Thank you.
Before we end for the day, I want to make sure that Crystal is able to make a comment or ask a question. So if she could be unmuted, please, that would be great.
Crystal, you should be able to come off mute.
Hi, everybody. So I have a couple things. One, when you were talking about the pay form, could you please explain how penalties work? Two, can you please explain the changes to the Elevate newsletter? I was questioned about it yesterday. And three, when you send out the slides, can you also send out a list of all the links that you put into the chat? Because once we close this meeting, they disappear.
Okay. Yes. So the main
Thank you.
important thing about the late and partial payment request forms that if you are eligible for penalty fees, that clock does not start until you have submitted it to the request form. So yes, you may experience that were paid late in December. You filed the payment issue in January, the clock doesn't start till January, and then up until the time that you do get paid.
Crystal, I just want to point out too that we have a lot of different power hour sessions, and I believe later JJ will present again on late pay penalty fees. And we'll also have an opportunity, I believe the next session is about training through Carewell and OHCC. So we have other opportunities to share that information. But training team, if you wouldn't mind answering the question about the Elevate news or talking about the changes to the Elevate newsletter.
Sure, I can step in. This is Susan Whitley. I'm a learning development specialist with the OHCC training unit. The Elevate has been divided up into three different sections. It's now just the Elevate newsletter with traditional articles, things that you see long term, like background checks, workers' comp information, resources, and it has the length of it has just been shortened quite a bit. And then we have a separate edition that is going to be for the class schedule that will show you the different classes that we offer, and that's going to be every 2 months. We'll also have certification section in there in our next edition that will talk about the different certifications that you can get through OHCC. This is also available in all of our languages. So the class schedule is every 2 months. The Elevate newsletter will be every 3 months. And then we have also a news flash, which is where we'll post information, any important information that you need to know before the Elevate newsletter comes out. Those could be sent out like through email electronically. So those are the three different editions. If you look at our January, February, March Elevate, it does talk about the different editions that we'll have available this year. Hopefully they answer your question.
Thank you. And so we are having to end the power hour. I just wanted to remind everybody that we will send out this PowerPoint that has all the links to it. It will also be posted on our website and we'll have it translated as well. It'll be posted first in English, but if you do follow those links, you can change the language on the screens so that you can see that information in your language. Okay, Susan.
All right. Well, it was great having you guys here for our first Power Hour of 2026. We'll see you next month and have a great day.
Bye, everybody.
You too. Thank you.
Bye. Thank you.
Bye-bye.